Hi and Assalamualaikum Miss. My name is Norkalisa binti Zunika. I'm Year 3 dental student of UiTM. Today, I would like to explain to you about your periodontal condition based on all the examinations and investigation that I got. Before we deep down into your case, I would like to explain the basic knowledge of periodontal to you so you can understand a bit about your condition. First and foremost, periodontology is the specialty of dentistry that studies supporting structure of teeth, which are the gums and bones surrounding the teeth, as well as disease and conditions that affect them. The periodontium, which is the supporting structure of the teeth that keeps them firmly in place, consists of four basic structures, which are the gingiva, usually we say gums, which surround and protect the neck of the tooth. Next is the cementum, which cover the root of the tooth. And after that, the periodontal ligament, which lies between the cementum and the alveolar bone and attaches the tooth to the bone. And last but not least is alveolar bone, which forms the tooth socket and supports the tooth. Next, the illustration shows diagram of healthy and unhealthy gums. In healthy gums, the gingiva, we can see that the gingiva appears coral pink in color, firm and tightly attached to the teeth. In contrast, unhealthy gums appear reddish, inflamed, swollen and irregular in shape, with the gums pulling away from the teeth. Based on the intraoral photograph, most of your gums appear inflamed, swollen, and reddish, and in some areas the gums are slightly puffy, which may indicate early signs of periodontal problem. If periodontal problems are not treated early, they can progress to gingivitis and periodontitis. Here I have attached a diagram showing the progression of periodontal disease. When the gums begin to bleed, swell, or become inflamed, this may indicate gingivitis. Gingivitis is usually reversible with proper treatment. However, if left untreated, it can progress to mild periodontitis, which marks the beginning of bone and tissue loss around the teeth. The next stage is moderate periodontitis, characterized by further destruction of the supporting bone and tissues. The final stage, severe periodontitis, involves extensive bone and tissue loss, and the teeth may become loose or even at risk of falling out. On top of that, there are several risk factors that can contribute to periodontal disease, including poor oral hygiene, smoking and tobacco use, genetic predisposition, certain medications, and systemic conditions such as diabetes. In your case, the most significant risk factor is diabetes, which can affect the gums by reducing blood flow, impairing the immune response, and slowing wound healing, making your gums more vulnerable to infections and periodontal disease. Managing your diabetes along with good oral hygiene is therefore essential to protect your gum health. After that, we will look into your periodontal charting. When we look at your gums and teeth, we measure the depth of the space around your teeth, and ideally they should be 1 to 3 millimeters. But in your case, several areas are deeper, showing that your gums have pulled away from your teeth, and this has caused some bone loss in certain areas. Other than that, we also check for bleeding, which are highlighted up by the red color, showing that most of your gums that surround your teeth have bleed easily, and it indicates your gums are inflamed. And also some of your teeth show mild mobility, meaning they are little loose, and a few areas have more serious bone loss. Next, we will look into your radiograph, and in this radiograph, we can see that there's a reduction in the bone that supports your teeth, with a vertical pattern of bone loss, and this indicates that the bone has been lost unevenly, which is a sign of periodontal disease. And since you have a deep periodontal pocket and bone loss is evident on the x-ray combined with diabetes, your gums are more vulnerable, and therefore proper periodontal treatment and close monitoring are essential to prevent further damage. Hence, for your prognosis for your case is guarded to fair, because with proper periodontal treatment, good oral hygiene and diabetes management, further bone loss can be controlled. If without proper periodontal treatment, there is high risk of tooth and tissue loss. Plaque is a sticky layer of bacteria that form on your teeth every day. If it is not removed, it can cause gum inflammation, bleeding, and bad breath, and over time, it can lead to periodontal disease such as gingivitis and periodontitis, and also can cause tooth decay. So by brushing and flossing and mouthwash regularly, you can remove plaque, protect your teeth and gums, and also can prevent serious dental problems. So now let me introduce to you about our dental tool kits, which will improve your understanding about each function of all dental tool kits. So let me start for toothbrush. So we have several types of toothbrush, which this is a normal toothbrush, this is a child toothbrush, and this is single tufted toothbrush. For your tips, if your toothbrush look like this, you must to change the new one so it can keep your oral hygiene. So all these toothbrush have same function, which is to remove plaques and food debris from the surfaces of your teeth. But for a single tufted toothbrush also has the same function as other toothbrush, but it clean in more small areas or hard to reach areas. Next, we go for tongue scraper. Tongue scraper is to remove bacteria and debris from the tongue to reduce bad breath. Next, we go to toothpaste. You must choose a toothpaste that contains fluoride in it, as you must know that fluoride, it is essential for you to know that fluoride is important to straighten your enamel, prevent cavities, and to help clean your teeth. Next, we have a mouthwash. Mouthwash is used to kill bacteria and reduce plaques, freshen breath, and helps prevent the gum disease. Next is a interdental brush. Here I have many variant in size of shape of interdental brush, which function is to clean wider gaps between teeth and around braces and bridge. Last but not least, I also have dental floss, which there are several types of dental floss. First of all, it is usually dental floss that we use is floss thread, and this is a super floss thread, and this is a floss with handle. All these floss have same function, which is to clean between teeth where the toothbrush cannot reach, removing plaques and food particles, and you can use either one, any of these dental floss. And that's all from me. Now I will demonstrate to you some techniques in brushing your teeth, dental flossing, and interdental brush, so you can practice it at home. Now I will show you how to brush your teeth in a correct way. The most recommended to brush your teeth is we use a modified base brushing technique. So let's start. We use adult's normal toothbrush and angle it to the 45 degree, and the bristle of the brush must be contact in the gingival margin and tooth surface. So after we put angle it 45 degrees, we do a circular motion several times and follow it by rolling the brush away from the gingival margin. I will show it again. 45 degrees circular motion and pull it away from the gingival margin. Also, the same technique applied for posterior teeth, lingual. So we do 45 degrees and circular motion and rolling away the brush from the gingival margin. I will show it again. 45 degrees circular motion, rolling away from the gingival margin. Next, for the palatal aspect, which is behind the tooth, behind the teeth surface, we must straight the toothbrush and put it here, and at the same time we must ensure that the bristle of the brush must be contact between the gingival margin and tooth surface. And also do the same, we will do the circular motion and follow it by rolling away the toothbrush from the gingival margin. Also, same as the lower teeth, lingual aspect, we do straight the toothbrush, we do circular motion several times and rolling away the brush from the gingival margin. Okay. So that's all for brushing technique. So next we will go into the how to floss your teeth in a correct way. So first we take the length of floss teeth. So we will wrap our fingers like this, and then put the thumbs, both our thumbs, on the floss to control how much pressure we insert into the space between the teeth. So next, when you have past contact point between teeth, make C shape hugging the interproximal surface as per demonstrated. After that, I will show you how to use interdental brush in a correct way. And before that, you must, as you know, we have a variant in size of shape of interdental brush. So you must know how to choose the correct size of interdental brush to fill up your gaps between the spaces of your teeth. So I will choose the smaller size in interdental brush. So after identifying the correct interdental brush size for the specific interdental space, ensure the interdental brush insert the brush into the space for at least 4 to 5 times. Next, I will explain and demonstrate to you how to use a single tufted toothbrush. As I explained before this, single tufted toothbrush, it cleans in small areas or hard to reach areas. Based on this model, usually we have some difficulties to brush to clean our teeth at the posterior side. So first of all, we put the bristle of the brush between the gingival margin and tooth surface, and we use a sweeping motion. And usually like this. Also the same for other sides that you had difficulty to brush your teeth. Since your gums are showing signs of periodontal disease, there is inflammation and some bone loss around your teeth, the goal of periodontal treatment is to remove the bacteria and plaque causing the problem, control infection, and prevent further damage. Treatment usually involves scaling and root debridement, good oral hygiene at home, and regular dental checkup. I recommend starting with scaling and root debridement to remove all the plaque and bacteria around your gums. Dental scaling is a non-surgical deep cleaning procedure used to remove plaque and tartar from below the gum line. Meanwhile, the root debridement, root planing, involves cleaning the roots of teeth below the gum line to remove plaque, tartar, and bacteria, allowing the gums to heal. Here is an illustration showing the before and after treatment. Post-treatment usually will affect you that you will may notice such as gum soreness or tenderness for a few days, tooth sensitivity to cold or sweet foods, and also you might notice there will be minor gum bleeding, especially during brushing. With proper care and follow-up, effects are usually temporary and the treatment will help improve your gum health. And that's all from me. Thank you.